Welcome to Dr. Alicia's MedTalks, where we explore natural, science-backed health solutions to improve your quality of life. Today's discussion centers around a condition that affects millions of men globally, but is still surrounded by silence: erectile dysfunction (ED). Affecting over 30 million men in the U.S. alone, ED becomes increasingly common with age. If you're over 40 and facing challenges with sexual performance, you're not alone. And the great news is that there are numerous natural methods that can help you regain confidence and vitality without rushing into medications. Before diving into remedies, it's important to understand what erectile dysfunction really is. At its core, ED is defined as the persistent inability to achieve or maintain an erection firm enough for sexual activity. Occasional issues are normal and typically harmless, but when the problem persists, it warrants attention. ED may result from physical causes such as cardiovascular disease, high blood pressure, diabetes, hormonal imbalances, and obesity, or psychological triggers like anxiety, depression, and relationship tension. Lifestyle habits like smoking, heavy drinking, and sedentary behavior can worsen the issue. What's often overlooked is the mind-body connection. Since arousal begins in the brain, stress or anxiety can interfere by triggering hormones that restrict blood flow. Performance anxiety, in particular, can form a vicious cycle. Worrying about sexual failure can cause it to happen repeatedly. Breaking this cycle is crucial for healing, and several natural strategies can help. The cornerstone of a natural ED treatment plan lies in lifestyle modifications that support not only sexual function but overall health. One of the most powerful tools is regular exercise, which boosts blood flow, enhances cardiovascular fitness, reduces stress, and helps regulate weight, all of which are essential for healthy sexual performance. Aim for at least 150 minutes of moderate aerobic activity weekly, like brisk walking, cycling, or swimming, paired with strength training twice a week to support testosterone levels and muscular health. Diet is equally vital. Foods rich in nutrients that support circulation and hormone production form the foundation of sexual health. For example, watermelon contains citrulline, a compound that relaxes blood vessels and mimics the effects of Viagra in a gentler way. Dark chocolate, loaded with flavonols, improves circulation, while zinc-rich foods like oysters support testosterone production. Leafy greens, including spinach, help boost nitric oxide in the body, promoting blood vessel dilation and better circulation. Nuts and seeds like walnuts and flax seeds contain healthy fats and essential nutrients that support cardiovascular health and hormone balance. Staying well hydrated is another key, as dehydration can reduce blood volume and impair energy levels, both of which are necessary for sexual performance. Aim for at least 8 to 10 glasses of water a day and reduce dehydrating substances such as caffeine and alcohol. Speaking of alcohol, moderation is critical. While a small amount may relax you, excessive drinking is a common cause of ED. Many men notice performance improves when they cut back or eliminate alcohol altogether. Another often neglected factor is sleep. Quality sleep is crucial for hormone regulation, especially testosterone, which peaks during rest. Poor sleep habits, including sleep apnea, are closely linked with ED. Developing a consistent bedtime routine, reducing screen time before bed, and ensuring your sleeping environment is dark, cool, and quiet can significantly improve sleep and, by extension, erectile function. Addressing stress is also essential. Chronic stress raises cortisol, which suppresses testosterone and restricts blood flow. Mindfulness practices such as meditation, breathing exercises, and yoga can reduce this stress. Just 10 to 15 minutes a day of focused breathing or meditation can recalibrate the nervous system and improve arousal and performance. Yoga is particularly effective as it combines movement and breathwork while also increasing pelvic circulation and strengthening the core. Speaking of the core, pelvic floor exercises, often known as Kegels, are not just for women. These exercises strengthen muscles responsible for blood flow and ejaculation. To find the right muscles, try stopping the flow of urine midstream. Practice contracting these muscles for 5 seconds, then releasing for 5 seconds, doing 3 sets of 10 reps each day. With regular practice over a few weeks, many men notice significant improvements. Herbal supplements also offer support, though they should be used cautiously and with guidance from a healthcare provider. Panax ginseng, often called herbal Viagra, has shown positive effects in some studies. L-arginine, an amino acid, boosts nitric oxide levels. Horny goat weed, maca root, and Tribulus terrestris have all been used traditionally to support male libido and sexual performance. However, since supplements aren't regulated as strictly as pharmaceuticals, ensure you're buying from reputable sources and consult your doctor, especially if you're on other medications. One of the most overlooked yet powerful tools in overcoming ED is communication. Shame and embarrassment often lead men to withdraw from their partners, which only increases tension and anxiety. But open and honest conversations can strengthen emotional intimacy and reduce the pressure around performance. Many partners are supportive and willing to explore different types of intimacy beyond intercourse. Emphasizing physical closeness, sensual touch, and emotional connection can improve your relationship and lessen the anxiety that contributes to ED. Mindful intimacy practices like sensate focus can also help. This technique, developed by sex therapists, involves slow, non-sexual touch with no pressure to perform. Partners take turns giving and receiving touch, gradually progressing to more intimate contact only when both feel comfortable. This approach removes the performance-based mindset and allows for organic arousal to return. While natural remedies are often effective, it's important to know when to seek professional help. If ED appears suddenly, doesn't improve with lifestyle changes, or is accompanied by other symptoms like fatigue or depression, it may signal an underlying medical condition like heart disease or hormonal imbalance. In such cases, consulting a medical provider is essential. There are many medical and therapeutic options available, and addressing the issue early leads to better outcomes. Another important aspect is maintaining realistic expectations and patience. Improvement might be gradual and nonlinear. Keep a journal to track your progress, noting days when things go well versus days that are more difficult, and correlate them with variables like stress, sleep, diet, or exercise. Over time, patterns may emerge that help you understand what supports your sexual health best. Testosterone, the key male hormone, plays a significant role in libido and erectile function. It naturally declines with age, but lifestyle can influence how steep or gradual that decline is. Ways to support testosterone include resistance training, especially high-intensity interval workouts, maintaining a healthy weight, managing stress, and ensuring sufficient intake of nutrients like vitamin D and zinc. Sleep is again important, as most testosterone is produced during deep sleep. If you suspect low testosterone levels, a doctor can perform blood tests and discuss safe treatment options. Good circulation is another cornerstone of erectile function. Cardiovascular workouts help the most, but additional practices like contrast hydrotherapy, alternating hot and cold water in the shower, can stimulate blood vessels and improve flow. Dry skin brushing and massage can also support circulation, particularly in the lower body and pelvic region. Even your home environment affects your sexual health. Reducing exposure to hormone-disrupting chemicals found in plastic containers, non-organic produce, and personal care products can help balance your endocrine system. Ensure your bedroom is a relaxing space. Keep it free of electronics, clutter, or stressful reminders like work materials. Comfortable bedding, natural fabrics, and a neutral temperature can all create a more inviting atmosphere for intimacy. One of the most effective steps for men who smoke is to quit. Smoking is a major contributor to ED due to its damaging effects on blood vessels. Studies show that quitting smoking can lead to significant improvements in erectile function within weeks or months. Support options include nicotine patches, medications, and behavioral counseling. The benefits go well beyond improved sexual performance, reducing risks for numerous chronic diseases. It's also essential to understand the strong link between erectile dysfunction and cardiovascular health. ED often occurs several years before signs of heart disease appear. The same issues that clog arteries in the heart can restrict blood flow in the smaller vessels of the penis. That's why addressing ED through natural methods doesn't just treat the symptoms, it can protect your overall heart health too. By improving your diet, moving your body, quitting smoking, managing stress, and nurturing your emotional relationships, you're not just helping your sex life, you're adding years of vitality and health to your life. As we wrap up, Remember that sexual health is multifaceted and deeply connected to your physical, emotional, and relational well-being. It's not just about sexual performance, it's about quality of life. Natural strategies like healthy eating, exercise, better sleep, mindful practices, open communication, and appropriate supplementation offer a holistic path to recovery. And even if these approaches don't cure ED completely, they contribute to a healthier, more fulfilled life overall. You deserve to feel confident, connected, and strong, no matter your age. Thanks for joining me on this important journey. If you found today's episode helpful, be sure to subscribe to Dr. Alicia's MedTalks for more holistic health content. Share this video with others who might benefit, and let us know in the comments where you're tuning in from or what topics you'd like us to explore next. Until next time, take care of your health, honor your body, and remember, healing is always possible, naturally.